Hello, good evening.
Good evening, sir. We're about to start in a minute now.
Sorry, yes, I'm just test running.
Oh, okay. All right. Thank you,
Yeah, you
sir.
will soon be on the table.
Yeah. Yeah. Thank you,
Yeah,
sir.
thank you.
Yeah.
Yeah, thank you very much.
Good good evening, everyone. Good day, everyone. I hope you can hear me.
Good day.
Okay,
Yeah.
awesome. Yes, good day, good morning, good afternoon, good evening, everyone. We are welcome to the day we have been waiting for. The D-Day is finally here. So I welcome us all to this historic moment, distinguished guests, esteemed colleagues, our friends and partners. You're welcome to the inauguration and website launch of Oncology Nursing Society of Nigeria. If you're excited to be here, which I am sure you already are, you can send your reactions and drop your excitement emojis in the chat box. It is my utmost pleasure to welcome you to this monumental occasion in time. And that is, as we all know, the inauguration of the Oncology Nursing Society of Nigeria. My name is Olamide Esther Taiwo, and I am privileged to be one of the moderators for today's event. Once again, I welcome us all to this event. I can see, I welcome everyone. Can see Dr. Chinom, so you're very welcome. I can see Mrs. Lawal. We are privileged to have the registrar for the Nursing and Midwifery Council of Nigeria in our midst today, in person of Dr. Indagi Al-Hassan. Can we welcome him? You're very welcome, sir. We appreciate your presence with us today. Thank you for joining us. Thank you for joining us. We truly appreciate everybody. We are all special. We are all special in this place, and we appreciate our presence. We invited you and you came. Thank you so much for coming. On behalf of the organizing team, once again, I would like to extend a warm welcome to everyone joining us. Your presence indeed is a testament to the shared commitment that we all have in advancing nursing care in oncology in Nigeria. So permit me to say that if you invited someone, this is a great time for you to remind all your invited guests that you might have invited and tell them that the webinar has started. We have officially started the inaugural webinar. And as we take the welcome address and the opening remarks, you can do well to share with us who you are and where you're connecting from in the chat box below. Thank you so much once again for coming. Finally, please note that you are free to react to the program highlights using the react button on your screen. And as well, you can interact with the moderators if you're having any issues at any point during the course of the webinar. Thank you once again. My name is Olamide Taiwo. Allow me to introduce the next moderator for the next item. Thank you very much.
Yeah, hello. Greeting of the day to all of our distinguished guests. I'm Fatima Adam. I'm the second moderator of this event. It's my great honor to welcome you to the inauguration of Oncology Nursing Society of Nigeria, ONS Nigeria, and the official launch of our website. Today marks a significant milestone as we come together from all parts of the world to advance oncology nursing and cancer care in Nigeria and beyond. With the theme, Innovation and Compassion. Sharing the future of oncology nursing in Nigeria, we aim to foster collaboration, innovation, and excellence in cancer care, empowering oncology nurses and cancer care providers to make lasting impacts. We are especially grateful to be joined by our esteemed leaders and representatives from leading organizations, including the UICC, Union for International Cancer Control, the NCS, Nigeria Cancer Society, Nigeria Cancer Research and Treatment Foundation, NICRAT, the Nursing and Midwifery Council of Nigeria, Nobody knows or coordinates the nurses better than the NMCN. The Oncology Nursing Association of Nigeria, ONAN, that's the umbrella for the Nigerian Trade Oncology Nursing Society. So Nigerian NLCC, that is the NSIA Youth Cancer Center, Think Africa Project Think Blue, Beacon Foundation, the First Foundation, and many other are tirelessly working to improve cancer care and patient outcomes. You're all welcome. We are also privileged to have Jessica McIntyre, the president of Oncology Nursing Society of the US, all the way from US, with us as our keynote speaker. Our global leadership and expertise will inspire and guide us as we work together to shape the future of oncology nursing in Nigeria and worldwide. Today's event features an exceptional panel of experts, including Nurse Nana Hawalawa, the coordinator of School of Post-Basic Oncology Nursing in National Hospital Abuja. I'm one of our products and I'm very proud. I know she's a very proud nurse of such facility. Nurse Michelle Magongolo, oncology nurse manager from the NSI Elite Cancer Center. That's the #1 cancer center in Nigeria. She is the superpower of NSI Elite. Nurse Michelle Magongolo, you're welcome. Professor Sunday Adewi, the professor of radiation and clinical oncology, ABUTH Zaria. Prof has been a wonderful oncologist in Nigeria. He has been doing wonderfully well. We also have Dr. Kemi Oguyemi, the special advisor on health to the Lagos State Governor, former oncology nurse manager at Marcella Roots Cancer Center. She's not only a special advisor, she's a mother, and she has been the mother of oncology nurses in Lagos State. She has been doing wonderfully well. She's a spark in the light, in the darkness of oncology nursing in Nigeria. So we also have Professor Deborah Esson, Professor and Dean Faculty of Nursing, Bowen University. She's the mother of all the nurses in Bowen. You're welcome, ma. Their insights will be invaluable as we discuss the future of oncology nursing and cancer care. In addition to this exciting discussion, we are also launching the ONS Nigeria website. That's fantastic. So a dynamic platform that is designed to connect, inform, and empower oncology nurses and cancer care providers from across the globe, not only in Nigeria, but all across the globe. So this site will be a hub for education, networking, and collaboration, supporting our collective mission. That's our mission, to see how we navigate cancer care, to educate us, to provide networking, to help us know people more, and serve as a collaboration. So as we embark on this journey, we warmly invite all of you to partner with us, whether you are interested in sponsoring, collaborating, or contributing in other ways. Your involvement is essential. We need your support to ensure the continued growth of oncology nursing in Nigeria and to make a meaningful impact on cancer care in our country and beyond. Thank you for being here today. Your participation reflects our collective commitment to improving cancer care and shaping a brighter future for those affected by cancer, both in Nigeria and around the world. Thank you very much. So, Dr. Onwozuchi Chinamso, over to you, sir. Thank you.
All right. Standing on the existing protocol, I want to give us a brief history of how the Oncology Nursing Society actually emerged. In 2016, the vision of the Oncology Nursing Society was, that is when it came to light. It was born out of a heartfelt recognition of the urgent need to address the growing cancer burden in Nigeria. While attending an international conference, I was struck with the level of disparity in resources and professional development opportunities for oncology nurses in low and middle income countries, which when you compare with their counterpart in the developed countries, you see that we are lagging behind. So at that point, I envisioned a professional society that would empower Nigerian oncology nurses to become leaders in caring for patients who have cancer and their relatives. These nurses will be equipped with evidence-based practices and supported by a strong network of peers. Over the past several years, I worked tirelessly to build the foundation of the society, I organized meetings with like-minded people, like-minded nurses, and presented some of the vision in different conferences. And at that point, I garnered a lot of support from the International Nursing Organization. In early 2024, the vision became even more momentous when I and along other committed group of Nigerian nurses who had now the board of directors formed a steering committee to lay the groundwork for the society. Together, we crafted the society's goal, structure, and mission to support oncology nurses and also advocate for persons who live with cancer and drive research and innovation in the field of oncology nursing. Today is the 21st of November, 2024. It marks the culmination of years of dedication, collaboration, and perseverance. The Oncology Nursing Society of Nigeria is being officially launched today, signifying a historic moment in the fight against cancer in Nigeria. Today's event is attended by different people, which have been mentioned, and a couple of others who will join later on. There are oncology nursing leaders, medical professionals, healthcare leaders, and even supporters from around the world. They've come to celebrate us today and to witness the formal launching of the society. But it's also a hope. It's also an evidence that represents hope for patients and their family members who are affected with cancer. What began as a dream in 2016 is now a reality that will shape the future of oncology nursing in Nigeria, even in generations to come. ONS is an official member of the International Society of Nurses in Cancer Care and a proud partner with the Oncology Nursing Society in the United States. Every member, by virtue of being members with this international society, we have access to free international oncology nursing journals. We are also partnering with the Daisy Foundation. I still spoke with the directors last night. We are partnering with them to recognize and reward outstanding Nigerian oncology nurses. This means that we will continue to form strong partnership with all cancer institutions in Nigeria to realize this goal. We envision that oncology nurses will be a leading force in transforming cancer care. We envision that these oncology nurses will begin to take their seats at the cancer care decision making at the national level and also international stage. Nurses will lead the way in championing cancer care research, especially when it comes to clinical trials. Our mission is to advance excellence through education, research, advocacy, and collaboration. And our vision is to be a leading force in transforming cancer care in Nigeria by advancing oncology nursing practice, fostering innovation, connecting nurses with opportunities, and then driving excellence in person-centered care. These are our goals. The most important one is to empower nurses, and it's the fifth one, and that is what drives the majority of all our activities today. This is our logo, which comprises of two leaves. One is blue, one is yellow. Two of them are arranged side by side. The blue leaf represents the nurses, embodying their professionalism, their care, and their dedication, while the yellow leaf signifies the cancer community, reflecting the hope, resilience, and the journey towards recovery. Now, the combination of these two leaves together, they are intertwined at the base slightly, illustrating the close connection, the close supportive relationship between the nurse and the patient and their relatives that they care for. So this is basically the little background of oncology nursing, and we appreciate everybody for joining us in launching this wonderful society. Thank you so much. So now we'll listen to the short opening remark by Dr. Jessica Mesentier, the president of Oncology Nursing Society in the United States.
Hello, esteemed members of the Nigerian Oncology Nursing Society. I am thrilled to extend my heartfelt congratulations on behalf of the Board of Directors of the Oncology Nursing Society for the establishment of the Nigerian Oncology Nursing Society. This moment marks a significant step forward in the development of oncology nursing within Nigeria, and we are truly honored to witness this milestone. I would like to express my gratitude to Chinormso Wuzichi, the founder and president of your society, for the opportunity to share some brief thoughts with you today. Nurses play a crucial role in healthcare, especially in oncology, where compassionate care and specialized knowledge significantly impact patients' lives. We acknowledge the unique challenges faced by nursing professionals in Nigeria and the immense potential to advance the field of oncology nursing. Through shared resources, education, and best practices, we hope to support your effort in enhancing patient care and advancing the oncology nursing profession in Nigeria. Together, we can cultivate a network that empowers nurses, promotes innovation, and champions the health of our communities. We are excited to see the impact of the Nigerian Oncology Nursing Society as it fosters a community of learning, collaboration, and professional growth. Your dedication would undoubtedly advance the practice of oncology nursing and improve the health outcomes of the people of Nigeria. Anthropologist Margaret Mead was quoted as saying, "Never believe that a few caring people can't change the world, for indeed that's all who ever has." 20 nurses in 1973 decided to create the Oncology Nursing Society, and today we stand proud with over 35,000 members strong in the United States. I commend the many volunteers who have stepped up to build a supportive community for Nigerian oncology nurses, enabling them to connect, feel empowered, and continue to acquire the knowledge needed to provide the best care for oncology patients in Nigeria. Once again, congratulations on this remarkable achievement.
Okay, now we are going to invite the registrar and Secretary General and CEO of the Nursing and Midwifery Council of Nigeria to inaugurate the society and also provide, share his goodwill messages for the society. Thank you. It's Alhaji Al-Hassan Dagi, the registrar of the Nursing and Midwifery Council. Is he on board? Yeah, let's just give him a few minutes. Okay.
15? Okay. Hello.
Hello, sir. We can hear you, sir. Over to you, sir.
Thank you. Is that Dr. Chinonso?
Yes, I am.
Well done. How are you?
Thank you so much, sir. I'm fine.
Thank you very much. Sorry for joining you late in this meeting. We have been top management committee meeting of the council since morning and entered into another virtual meeting from a foreign body. Now we are with you, and then what I think my role is the inauguration of the ceremony and the website launch of the Oncology Nursing Society. May I start with felicitations from the Council to the Oncology Society of Nigeria, and then congratulating you, appreciating you for bringing on board this provision that will enable facilitation of knowledge sharing. However, let me take my speech by recognizing all the guests on board. The launch of Nursing Oncology Society of Nigeria website is a significant step forward in enhancing cancer care and support within Nigeria's healthcare system. This platform is set to be a valuable resource for oncology nurses, patients, and other stakeholders, offering access to the latest information, educational resources, and best practices in oncology nursing. This will eventually promote excellence in oncology nursing, as this digital platform will enable better connectivity among oncology professionals, paving the way for professional development, knowledge sharing, and comprehensive patient support nationally and globally, which will improve quality of care and better prognosis among cancer patients in Nigeria. A dedicated website for oncology nurses holds a great importance as it serves as a central hub for resources and community support tailored specifically to their needs. The Council hopes the website will benefit oncology nurses on: one, access to updated knowledge in treatment protocols, medications, guidelines, and research. Two, professional development, that is, certification programs, webinars, and workshops. Three, networking and support. It can also facilitate networking and mentorship opportunities that are crucial for resilience. Fourth, patient education tools. The website can help nurses educate their patients more effectively, improving patient engagement and outcomes. Lastly, advocacy and awareness. It can serve as a platform to engage healthcare organizations and the public. In essence, a tailored for oncology nurses is an invaluable tool, supporting their work, enriching their knowledge, and ultimately enhancing the quality of care they provide for cancer patients. I want to thank you for listening, and by this, inaugurate the Oncology Nursing Society of Nigeria. Thank you very much.
Thank you so much, sir.
You're
We
welcome.
really appreciate you. Thank you for coming. Thank you for such a wonderful speech. We really appreciate you, sir. It is my honor to bring up on stage Dr. Kemi Ogunyemi, who would be anchoring the inauguration of the board members. She is a cancer nurse specialist, an oncology nurse specialist, and out of many caps that she wears so well, she is the special advisor on health to the governor of Lagos State. Could you, with a rounding and resounding applause, let us welcome Dr. Kemi Ogunyemi on stage as she comes for the inauguration of the board members. You're welcome, Ma.
Thank you. Hello, Madam Moderator.
Yes, sir.
Please, may I come back to the physical meeting I'm having in the office as I allowed you to continue with the remaining part of the agenda?
All right, sir. Thank you so much.
Thank you so much.
Thank you so much, sir. We appreciate you, sir.
You're welcome. Thank you.
Thank you.
All right, Dr. Kemi, we're so happy to have you. Thank you so much for coming.
Thank you so much. Thank you for having me. It's really, really a pleasure to actually be here and just see this inauguration, witness it, because it's been long overdue. Distinguished board members, esteemed colleagues, and honored guests. So today marks a significant milestone as we gather to inaugurate the esteemed Oncology Nursing Board. And I just want to charge you, that's my job. But before I do the charge, I just want to thank Dr. Chinonso Nwuzichi. Well done indeed. I mean, this is something that is, like I said, long overdue. But I want to charge all the members that they should uphold the highest standards of oncology nursing practice as they embody excellence, foster a culture of innovation, research, and evidence-based practice, and also, very importantly, promote interdisciplinary collaboration and teamwork. I also want you to lead with compassion by prioritizing patient-centered care and advocacy, support families and caregivers through the cancer journey. Also drive impactful change, develop and implement strategic initiatives to advance oncology nursing, and then also address disparities and inequities in cancer care. Also very important to foster partnerships with healthcare organizations and community groups. It's also important to empower education and research. So I charge the board members to promote ongoing education and professional development, support research initiatives and evidence-based practice, encourage innovation and entrepreneurship. You also need to govern with integrity by upholding ethical standards and transparency, foster open communication and stakeholder engagement. Your key performance indicators should actually be to improve patient outcomes and satisfaction, enhance oncology nursing workforce development, increase access to cancer care services, and foster collaborative research initiatives. Each of you, each individual board members, you're bringing in your expertise and passion, and you must bring these to board discussions. Participate actively in committee work and represent the organization with dignity and integrity. Together, you need to work collaboratively to achieve strategic objectives, support the organization's mission and vision, and embody the values of compassion, excellence, and integrity. So as you begin this critical journey together, I charge you to inspire confidence, drive impact, embody excellence, foster growth, serve with distinction. I really wish you all the best, and I know you can do it. I've seen all your pictures and read everything. And so I thank you for your dedication and your leadership. Congratulations to every single one of you. Thank you.
Thank you so much, ma'am. Thank you, thank you, thank you. We cannot thank you enough, Dr. Ogunyemi. Thank you so much. Right now, we'll be going over to unveiling the website, and we have Nurse Salako Omolabake on the line. will be doing that for us. Over to you, ma'am.
Hi, good afternoon, esteemed guests, fellow healthcare professionals, and members of the Oncology Nursing Society of Nigeria. I am Omolabake Silako, and I am beyond honored to be part of this historic event. Today, we unveil the digital platform that embodies our commitment to advancing oncology nursing in Nigeria. This website is more than just a website. It's a virtual hub for knowledge sharing, networking, and cancer advocacy. Now, our website resides at onsnigeria.org. So you can simply type that on your Chrome or any browser and you'll be right into our website. Now, briefly, let's go across some brief features of our website. We're going to be having awards because we are very dedicated to celebrating the achievements of oncology nurses in Nigeria. We'll also have scholarships because we realize the importance of education in oncology nursing, just as Dr. Ogunyemi discussed. We have scholarship, provide financial support to deserving nursing students and registered nurses who are willing to pursue great careers in oncology nursing. And also, we'll also be offering grants because research is at the backbone of oncology nursing. So we're going to be seeking funding for our research projects and also employ our oncology nurses to engage in research with the grants provided for them. So to learn more about all of this is right on our website. So you can engage us at onsnigeria.org. Also, we know that ONS Nigeria thrives on dedication and expertise for our members. And to achieve this, we have a list of committees that are dedicated to perform specific functions to elevate the oncology nursing in Nigeria. We have Leadership Development Committee, Education Committee, Advocacy Committee, Membership Committee, among others. So go on our website to explore these committees, and also if you're interested in joining a committee, that will also be available for our members. So thank you all for listening to me. And now we'll be going on to a very interesting part. I believe most of us here should be members of ONS Nigeria. But if you're not a member of ONS Nigeria, these are reasons why you should be a member of ONS Nigeria. The first one is professional development. It's very important to gain access to exclusive training programs, workshops, and vocational opportunities because it is important for us as oncology nurses. And also, we need to network with our fellow oncology nurses because without this network, we cannot improve oncology nursing in Nigeria. And also to help us in advocacy. And lastly, resource sharing, because sharing resources which is latest research, clinical guidelines will also help us to enrich the society and also enrich oncology nursing in Nigeria. To join ONS Nigeria, ONS Nigeria is open to registered nurses in Nigeria, both home and abroad, who are involved in cancer care. We invite all nurses to work in various settings, including hospitals, clinics, research institutions, and educational facilities. Our application process and membership fees will directly processed through our board of directors and also through our official ONSN channels. For application process, for this year, we will not be accepting membership dues because already end of the year. We're going to start accepting payments by January 2025. And for student nurses, it's just be 5K. And for nurses and other healthcare professionals, we'll be charging 10,000 naira for our membership fee. So official membership is going to start through our membership form, which will be released to the group and also in this Zoom link. But our official payment for membership will begin by January 2025. So thank you all for listening to me, and we invite you to join ONS Nigeria, and there are lots of amazing things we have in store for 2025 for oncology nursing in Nigeria. Thank you so much.
Thank you so much, Nurse Labake. That was so beautiful. Just like she has said, we welcome you to join the ONSN, to join the Oncology Nursing Society of Nigeria. So I believe we all are going to be a part of it. So in lieu of that, we call for donations, all right? If you are moved, which I know that you are. I mean, this is something big and something monumental. It's going to make a lot of changes in the oncology nursing space in Nigeria. And as such, we are welcome to donations of every kind, So feel free to reach out to me or to the president during or after the webinar to make your donations. All right, it's time for the next item, which is a very sizzling and scintillating item. That is the panelist discussion. the panelist discussion. I'm sure that we all have been waiting for this aspect as well.
What do I do?
But right before we
if
go
my dog
into
bit my
the
dick off?
panelist discussion, I'd just like to acknowledge some of our guests who we invited personally, and they are here. Please note that everyone is special. We really appreciate all of our presence. And if I could, I would mention
Am
all
I
of our
special
names
too?
now. But due to time and time constraints, I would just
I don't
mention
mind. I don't
our
mind.
invited that we see here right now. So please help us appreciate Nurse Obatunwashi. She is the Assistant Nursing Director from Ahmadu Bello University Teaching Hospital, Gombe. Yes, please, let's try to mute our mics. Thank you very much. Okay, we also have Professor Adamu Danladi, the DC MAP, Research and Training, Federal Teaching Hospital, Gombe. Very welcome. Thank you for coming. Mrs. Famuyiwa Taiwo, Deputy Director, Nursing Services, Lagos University Teaching Hospital. We welcome you. You're very welcome. Mrs. Akinola F. Olajumoke. She is the Director of Nursing Services, Lagos University Teaching Hospital. You're very welcome, ma'am. We also have Nurse Veronica Bako. She's an oncology nurse and nurse in charge of the Radiation and Oncology Unit, Ahmadu Bello University Teaching Hospital in Zaria. And of course, we have Suleika Nyas. She is the Chief Nursing Officer in charge of Amenity Ward and Oncology, National Orthopedic Hospital, Dala Kano. As the program continues, we'll continue to acknowledge each and every one of you that is here today. All right. So who is excited for the panelist discussion? If you're excited, I want you to, show your excitement in the chat box. Show your excitement in the chat box, because as I begin to call out the names of the panelists, you will agree with me that we have a rich lineup of healthcare professionals, nursing professionals, esteemed professionals joining us today. So yeah, once again, my name is Olamide Taiwo, and it is my distinct honor to moderate this panelist discussion. And before I bring our panelists on stage, I will just intimate us on the topic of discussion today, which is leveraging nursing expertise to improve cancer care outcomes in Nigeria. Leveraging nursing expertise to improve cancer care outcomes in Nigeria. I mean, this is an incredibly relevant, and you agree with me that it's a timely conversation as we try to address the growing burden of cancer in Nigeria. Ladies and gentlemen, we have a rich lineup, just like I said, of professionals in the house today. And so I am going to, be calling out their names in the house today. As I call their names and their very short profile, please let the resounding virtual applause, let it keep coming, let it keep coming, let it keep coming. Are we ready to do that? All right, I trust my audience, we're a very responsive audience, right? Okay, in no particular order, we have in our midst Nurse Nana Lawal. She is an oncology nurse and coordinator of the School of Post-Basic Oncology in Abuja. Come on, let's get the applause coming. I can't see the applauses. All right. We also have Dr. Kemi Ogunyemi. She's a cancer nurse specialist, as we already know, and she is the special advisor on health to the Lagos State Governor. Exactly. I knew I had a very responsive audience. Thank you for the applause. We also have today Professor Sunday Adewuyi. He is a distinguished professor of radiation and clinical oncology and a leading expert in cancer treatment in the Ahmadu Bello University Teaching Hospital in Zaria. You're very welcome, sir. Additionally, we have Professor Deborah Esson. She is the Dean of the Faculty of Nursing at Bowen University, a passionate advocate for advancing nursing education. You're very welcome, ma'am. We also have today, joining us for the discussion, Nurse Michelle Mangogolo. She is the nurse manager at the renowned NSIA Luth Cancer Center. That is the, yeah. And so that's the Nigerian Sovereign Investment Authority in Luth, that's Lagos University Teaching Hospital. She's going to be bringing our practical insights, from managing one of Nigeria's top cancer care facilities. You agree with me once again that we are so blessed in the house tonight. Finally, we have Dr. Zainab Shinkafi Bagudu. We know her, you know her. She is a global leader in cancer advocacy, the founder of the Medicaid Cancer Foundation, and she is the president-elect of the Union for International Cancer Control. That is the UICC. You're very, very, very welcome. Our audience says welcome. The whole team says you're welcome to the panelist discussion this evening. You're very welcome, everyone. Okay. I believe that our panelists are ready for us this evening. I believe they are ready. I believe they are ready. And we are also ready. The audience is ready. We are all ready to glean from, your wealth of experience in your various fields. I mean, we have policy makers, we have leading experts, leading physicians in oncology. We have nurse educationists. We just have a rich lineup this evening. All right, let's just dive right into it. Let's just get right into it. Thank you, everyone, for your beautiful responses. We appreciate you. Okay, allow me to remind you of today's topic of discussion, which is leveraging nursing expertise to improve cancer care outcomes in Nigeria. Leveraging nursing expertise to improve cancer care outcomes in Nigeria. Okay, I would love to open the discussion with Nurse Nana Lawal. I am sure she's here. Nurse Nana Lawal, I'm sure you're here today.
Yes. Yeah.
Thank you. Thank you so much. I would love to open the discussion with you. Ma'am, with over 2 decades of experience in oncology nursing, how have you seen the role of oncology nurses evolve in Nigeria? How have you seen the role of oncology nurses evolve in Nigeria? And what gaps do you see do you think still exist in leveraging nursing expertise to improve cancer care outcomes?
Good afternoon, everyone. All protocols duly observed. Thank you very much, Olamide Taiwo, for having me as one of the panelists.
Thank you, ma'am.
In this August and very apt inauguration meeting. I'm very humbled to be in your midst. First, I would like to just highlight the roles of oncology nursing in Nigeria so far in the last 20 or more than 25 years. I would like to start by saying that oncology nursing, to me, is the heart of cancer care. Why? Because oncology nurses provide compassionate, holistic, patient-centered care and support to cancer patients. And for me, for the past 20 years, the evolution of oncology nursing has been steady, slow, yet very engaging. I'm sure you will all agree with me that one of the very vital role of the oncology nurse in cancer care involves, doing a comprehensive assessment of cancer patients, from that to rendering chemotherapy care, from that to rendering chemotherapy side effect management to patients, like in terms of physical care, caring for breast cancer wounds and other wounds. From one center to the other, nurses are involved in rendering care for patients who are also receiving palliative care. And then this care is kind of provided, tailored towards strategies to ensure that all the other care, which includes emotional support, psychological support, financial, social, physical support, is rendered to these cancer patients to ease their anxiety and to improve their quality of life. One of the challenges, basically, so far is that most cancer patients come late. We have late presentation of cases, and that also increases the burden of work that the oncology nurses have to render to these patients. Our care also extends to providing navigation to patients throughout the continuum of cancer care, which will include advocating for access to care, because the nurse helps patients overcome systemic barriers by linking them to one point of care or the other. Also, in the navigational functions, we also try to link them up with financial aid programs, support groups, NGO, and ensuring continuity of care despite resource limitation. And a lot of researches have also shown that the function of the nurse in the care of cancer patients cannot be overemphasized. Why? Because they are involved in physical care, as I've mentioned before, emotional and psychological care. Studies have also demonstrated that health education led by nurses improves coping mechanisms and treatment outcome. This, I will stand high with my head high to say this, because this is one of the responsibilities that I have been faced with from the beginning of my practice of oncology nurse. I sit down, we take time to counsel the patient, talk to them about the drugs they are going to take, counsel, educate them on the possible side effects and how they can manage these side effects. All these we've been doing for the past 20 years. And also along the continuum, we have also been able to today have registered oncology nursing schools that have been accredited by the Nursing and Midwifery Council. I think today we have two registered, two accredited schools in Nigeria, National Hospital being the first, and then the one in Abakaliki being the second, and I'm sure more are coming up. So we do all this in spite of a lot of challenges. What are these challenges? They range from limited access to resources and to systemic policy gaps. And this we cannot ignore. Nurses are not involved in policy making that are concerned with rendering oncology nursing care. There's limitation to support for nurses for advanced education in order to give them confidence and to grant them evidence to be able to care for oncology nurses with a lot of confidence and support. There's also poor collaboration within the healthcare team in supporting nurses to achieve the goal of rendering the best practices of oncology nursing care in Nigeria. There's significant shortage of specialized oncology nurses. There's high patient to nurse ratio, leading to burnout and reduced quality of care. For example, a single oncology nurse might oversee dozens of patients, making it very difficult to provide personalized interventions to these cancer patients.
Wow.
If you allow me, I will just keep talking and talking. Unlimited training, there are a lot of limited training opportunities.
Definitely, yes.
And this and this is actually very much more, prominent in under-resourced facilities, like those you find in the rural areas. There's poor access to diagnostic and treatment facilities, which will eventually hinder early detection and all that. So if you allow me, I'll just keep talking. So thank you for having me in this panel.
Thank you so much. Thank you so much. We'll come back to you, Ma. That's wealth of experience speaking, wealth of experience and practice speaking. Thank you so much for your comments and your contribution to this. I also agree, and we all agree, we can see that resource limitation, is one of the barriers, we're facing in the oncology nursing space, in Nigeria especially. And we hope that our recommendations will keep being looked into to improve access and access to resources in oncology nursing care. Thank you so much. Thank you, ma'am. All right, that was beautiful. We're off to a great start, definitely. I would love to recognize the presence of Dr. Zainab. Dr. Zainab is in the building. Thank you so much. You're welcome, ma'am. Dr. Zainab Shinkafi Bagudu. We remember that she is the founder of the Medicaid Cancer Foundation and a global leader in cancer advocacy. You're very welcome, Dr. Zainab. We see you. You're welcome, ma'am. Allow us to continue the discussion with Dr. Zainab, if that's fine. All right, Dr. Zainab, can you hear me, ma?
Loud and clear. I can hear you very well. Good afternoon, everyone.
Good afternoon, ma. We are so pleased to have you here in our midst today. You're very welcome. Yes, ma'am. So we have been talking about leveraging nursing expertise in cancer care in Nigeria, and we are sure that your knowledge and your experience in cancer advocacy will prove very useful in our discussion today. So allow me to ask this question, ma'am, that as the founder of the Medicaid Cancer Foundation and a global leader in cancer advocacy, how can nurses in Nigeria engage more actively in advocacy and public health initiatives to enhance cancer prevention, early detection, and treatment outcomes? How can nurses, how can we engage more actively in advocacy and in public health initiatives more than we already are doing? How can we, ma'am? Thank you.
All right. Good afternoon again, everyone. It's an honor to be amongst you, and I congratulate you on the launch of your website and the efforts that you're putting into bringing the highlights and to attention oncology nursing as a subspecialty of nursing care. You've heard my name is Zainab Shinkafi Bagudu, and primarily I run cancer civil society organization which operates in the northern part of Nigeria. And aside from that, I do a lot of global work advocacy in trying to improve cancer outcomes in the country. And one of the basic tools of improving healthcare generally, as we heard the last speaker reiterate, is the need to highlight the positioning of nursing care as being pivotal to healthcare generally. And when it comes to oncology, it's even more relevant and important. Nurses are the bedrock of any department in a hospital, even in the community, and usually the first point of call for most people, including, I dare say, the oncologists, the high consultants themselves. As a medical student, one of my very first points and the people that I call on are the nurses, even before I call on the senior house officer or the registrar. And I have very fond memories of different nurses that taught me basic skills, setting a line. It wasn't a doctor, senior doctor that taught me, you're setting the tray for your cesarean section, knowing that the right things are there and so on. It may not be part of your duties later on, but it's very important and key that you understand everything and you do it properly. Clerking a patient, you cannot clerk a patient without having the right nurse by your side. So for me, I think that it's important that we see nurses as very multi-talented and multitasking parts of the whole care spectrum. Advocacy on its own is a very important part of what we all do. And there's no one better place than a nurse who comes, like I said, is the first point of call for most patients, especially for us in LMICs, where professional, really capable hands is not as at the level that we would like to see it, or access to health professionals is not equitable across the country and even the continent. So if your access is to a nurse, then that nurse is going to be she's going to give you the first diagnosis, your carer, palliative care, and so on, everything. So it's important that we see them as advocates to deliver the messages that we need to. If a nurse is seeing a woman in an antenatal care center, it's very good if she uses that opportunity to expose her to the different issues that she might face, both with her own health. And when we talk about things like cancer of the breast, there's no better opportunity to teach a woman and advocate for her to carry out regular self-breast examinations. Ditto when you look at childcare. How do you prepare your ORS? How do you administer the first line of analgesia or antipyretics for a child with fever to stop convulsions, and so on? There's so many things that you can do. For you to be good advocates, you need to understand the spectrum or the terrain that you're operating in. First of all, the cultural terrain, the way that a nurse in Kebbi is going to address her male and even female patients is very different from the way the nurse in Enugu is going to go about her task. So we have a lot of cross-culture professionalism in Nigeria. For instance, in Kebbi again, we have a lot of nurses that come from the southern parts of the country because the demand there is so high for the nursing spaces and there are not enough spaces. So, and up north, on the other hand, you don't have, in the past anyway, we didn't have as many taking up the opportunity or wanting to go to the colleges. So you find a nurse from Anambra State going to nursing, a girl from Anambra going to nursing college in Kebbi. And that is one of the things that I have tried to focus on in the last, should I say, 6 to 8 years. We've been mentoring and sponsoring nursing education. We groom girls from the community, get them interested in nursing as a career, understanding and appreciating the importance of nurses in our environment, and bring them into the college and sponsor their education. We just graduated, I think, about 6, the last batch, about 2 weeks ago. And it's such a fulfilling thing when you see them, they've been through their education, and now the next step is to get them to specialize in one part or the other. And I've been pushing and hoping that we'll have a lot more oncology nurses. So as advocates, you need to understand where you're operating in. Even me as a young medical doctor or a student, for me to examine a male in northern Nigeria as a woman is not something that can easily be done. You have to cajole them, you have to plead, you have to bribe, you have to be firm, you have to employ the help of the nurse who they trust more. It may be a male nurse that will they will only allow the male to touch them. Imagine me performing a prostate examination on a 70-year-old man. They look at you, and I'm not making up these scenarios. These are things that happen to me in real life. You know, what is this small girl trying to come and do? No, you can't touch me, and things like that. So you understand where you're working in and how you're going to approach the issue in a culturally sensitive way. I saw during the recent HPV vaccine rollout, there's some posters that are going around that went around, and I believe they're still around, that I found very inappropriate. You would find a male nurse injecting. We all know the issues and the misinformation around HPV vaccine. So on top of that, people in the community feel that HPV vaccine is just a means to sterilize girls and stop them from having babies. On top of that, we now had flyers, educational flyers, promotional flyers, urging girls to come out, parents to come out and vaccinate their girls, with a male nurse vaccinating a girl in a hijab. That is a no-no for me. So those are salient points that we have to understand about our communities, and understand that if you're talking about somebody in a hijab, then the mothers don't want to see a man around her. They either think that, no, why? So this thing is wrong, where it may not be sterilizing them, but it's wrong. We don't want a man touching our girls. So that kind of situation, you need to understand more. Then partnering with the whole care spectrum, with all the professionals that are involved in delivery. Nurses are very strong advocates, very strong activists. And for the younger ones that are coming up, it's a habit that I hope that you will imbibe and learn. They're very, very firm. Discipline should be your motto in your career, and also how to be firm about getting things done. There is no active union like the nursing union in Nigeria today. When they want a pay rise, the whole country shakes. So why don't we use that power to demand for better working opportunities, for better funding, for better pay, and so on, and all the things that we need to make our career more appealing and to make it easier for everybody. I also want to talk about global partnerships. There are many oncology organizations, nursing organizations, basic as well as a bit more complicated, a bit more organized and complicated, I would say, those are the specialized ones. But if you get involved with organizations, both within and outside the country, then it helps you to know what your focus is, and the goals of that organization will easily be imbibed in your daily life. Everybody's talking about UICC now. UICC and Dr. Zainab, it didn't start in one day, and it was something that grew to the level that it got to because I was interested, and I imbibed the values and the goals of the UICC in my daily work. So that kind of understanding what your entire organization is about and using it, leveraging on the opportunities that it gives you. We celebrate different days, and I look at the UICC page, especially when we started. What are we going to do? Is it cervical cancer? Is it breast? Is it prostate? How do they go about it? You pick ideas from other people that have done this for much longer and are making a success of it. So I think briefly, without boring everybody, I will stop there, and I hope that you have been able to glean something. Nobody can tell you the best way to do it. You will find out. And I hope that in that journey of finding out for you and for everyone on this call is going to be a very successful one, and one that benefits Nigeria and the entire world. Thank you very much for the invite.
Oh, we are so grateful to have you, Ma. We are so grateful. We heard it, it's like a motherly advice to us, especially young nurses like myself. She spoke of discipline, global partnership, even being on the forefront of advocacy, even as we are interacting with our patients in the clinical space. And I love how you began when you said that you engage with nurses. In the ward, a good ward round is having good nurses, having nurses around that, you can interact with even as a doctor. Thank you so much. Thank you very much, Ma. We really
I see one of my classmates there, Professor Adewuyi. Yes, maybe he'll tell you a bit more about school in Zaria, and I wasn't kidding.
That's lovely. You're very welcome. Thank you again, ma'am. Thank you.
Thank you so much.
I would just
yes. Thank you, Ma. Thank you, Ma.
You're welcome.
Thank you.
Yeah. I acknowledge your presence, sir. Professor Sunday Adeyemi. You're welcome, sir. We'll come to you very soon in this panelist discussion. We're sure you have a lot already in store to dish out to us in this program. Allow me to take a few seconds to recognize Professor Adamu Danladi, consultant, clinical and radiation oncologist, DC Mark Research and Training, Federal Teaching Hospital, Gombe. Also, allow me to recognize Nurse Rosaline Okumu. She is the President, Oncology Nursing Society of Kenya. You're very welcome, ma'am. And yes, allow me also to appreciate the presence of Dr. Olubukola Ayodele, a consultant medical oncologist, breast cancer researcher, global oncology advocate at University Hospitals of Leicester NHS Trust in the UK. We'll come back to you for the goodwill messages. Please prepare for that. Thank you so much. Thank you. While Dr. Zainab was speaking, she was speaking of education and how they've been able to sponsor that's a lot. That's a lot, in education, and then looking forward to see them specializing in different areas in nursing. And that is so, so beautiful. So speaking of education, you already know that we're going to Professor Deborah Esson. Professor Deborah Esson, she is a professor and the Dean of Faculty of Nursing, Bowen University. We're sure she's here. I'm sure she's here. Yeah. Ma'am, can you hear me, ma'am?
Yeah, I can hear you. I can hear you.
Beautiful. Thank you. Thank you so much for coming. Thank you. It's a privilege once again. So please allow me to indulge in this question, ma'am. So as an academic leader, how can nursing education in Nigeria be strengthened to prepare the next generation of oncology nurses to meet the complex demands of cancer care? How can nursing education in Nigeria to even be strengthened to present oncology nursing as an appealing field, and also to meet the complex demands of cancer care as we prepare the next generation of oncology nurses?
All right, thank you very much, moderator. Let me just at this point again join the host of others to congratulate Dr. Chinonsom and all the board members for this laudable project. I say laudable because this is really going to solve what I call grassroots problem. It's like a neglected area over time, and then now bringing it to limelight. So that's why I want to join the host of others to say congratulations. Yes, back to the discussion. I hear the issues of expanded curriculum at undergraduate level. I don't know if you can hear me. There's need for an expanded curriculum at undergraduate level and even for collegiate system. When I mean expanded curriculum, when you see the baccalaureate program as it is of today, we have there are 3 core nursing areas that have been earmarked. You talk about the general nursing, you talk about the midwifery, and then you talk about the public health nursing. The oncology nursing is not pronounced as it is in the curriculum. It's just it's a subset of med-surg. And so even when we teach it, we are not teaching it such that we could impact or train our future nurses to be cancer care advocates or oncology nurses. So there is need to, to bring about a revised curriculum such that when we lay emphasis on, nurses who want to be specialists who want to specialize in midwifery, nurses who want to specialize in public health nursing, from the graduate level, we should have what we call an organized curriculum where we, after it, catch them young. You can never beat these young ones, especially in the advent of what do we call it now? Computerized system. There was a project I was trying to pilot, risk stratification for community health nurses, towards risk prevention for cancer, early detection. What I mean by that is that we are trying to see, can we build an app for our nursing students that when they are deployed to the community, they can use that app to do what we call risk stratification based on, the genetic predispositions of individuals, lifestyle risk factors that could modify some of these cancers and all that. So I had said that there is need for Nursing and Midwifery Council of Nigeria to expand the current curriculum. And then there's also a need for an organized formal training in oncology. You know, the first speaker said we only have 2 accredited schools as far as she's concerned on oncology. I want to say that the only one I know recently, I just got to know, is that of the University of Abuja. We need to, because when we say expertise, we are talking about people who have been trained, not just an informal training, an organized training. People who have been trained to provide cancer care, and not just training now, they are certified. That means the certification goes beyond I've attended the training. They are certified as oncology specialists. So there is a need to, you know, have more organized training and more certifications so that we know that we have competent nurses who did not just acquire an informal education to provide cancer care, but they have gone through organized training in approved and accredited institutions to provide cancer care. And I also want to say that there's a need to train our undergraduates, and I mean nursing students generally, to be cancer advocates. When I mean cancer advocates, I mean around sensitizing them early. For example, we
Hello, ma'am. I think our call got disconnected. Okay, I'm sure she'll be with us soon. I'm sure she'll join in soon.
Hello?
Okay, we can hear you now, ma'am.
Oh, I had a network itch. I'm sorry.
No problem, ma'am.
Am I back now? Am I on
Yes,
now?
you are. Yes, you are back. Yes.
Can you hear me?
Oh. Seems we have a Nigerian network problem here. Okay. I'm sure we'll come back to you, Ma. I'm sure your network, when the glitch is resolved. Thank you so much, Ma. Thank you, Ma. Thank you. She made mention of the app, and I'm sure we have nurses in tech here, and I'm sure they grabbed that idea immediately because it's such a scalable idea. Right. We have Professor Sunday Adewi in the house. Yes, he's a physician and a cancer care expert at the Ahmadu Bello University Teaching Hospital in Zaria. Prof. Sunday, can you hear me, sir?
I can hear you loud and clear. Can you hear my baritone?
We can hear it loud and clear too. Thank you so much. Thank you for being here. It is such an honor to have you here. As we proceed in the discussion and as we conclude as well, I'd just like to push this question over to you, sir. Given your expertise in radiation and clinical oncology, what role do you see oncology nurses playing in bridging the gap between radiation oncology services and patient-centered care, especially in resource-constrained settings like Nigeria? We want to hear from your perspective as a physician. You know, what role do you see nurses playing in bridging the gap between radiation oncology services and patient-centered care, especially in a resource-constrained setting like Nigeria?
Thank you very much, Taiwo Olamide. It's a pleasure being here. The only man amidst 5 other wonderful women. As a thank you, I appreciate. And I want to congratulate your association or society for going this direction. It's wonderful. It will resolve and then bring to fore the need for more oncology nurses and the relevance of oncology nurses in the cancer space. I also want to thank my sister, Her Excellency, the President-elect of UICC. Thank you, ma'am, for coming. So when we look at the role or relevance of oncology nurses in cancer space, in cancer care, whatever, whether it's radiation therapy or oncological services, I'm so happy about your topic where you mentioned leveraging nursing expertise. Expertise is driven by knowledge, competence, knowledge and competence. And the nursing, oncology nursing is based on knowledge, is based on competence. I've actually met with most of the panelists. I know the principal, Nurse Nana Lawa, very well. And then we know the curriculum and we see the in-depth in knowledge acquisition when our nurses go for training. So acquiring knowledge and skills relating to nursing care is a fundamental aspect when you want to improve cancer care outcomes in Nigeria. Those days, fundamentally, nurses are selected based on beauty, smartness, and physique. And I'm here to say an ugly nurse. And I've never seen an ugly oncology nurse. Your beauty, your dressing, your simplicity allays a lot of anxieties when it comes to cancer care. A cancer patient, according to research findings, 60% of them will not remember what we are discussing with them in the consulting room because of anxiety, because of fear of unknown, because a day before they did not know what the oncologist, the doctor will speak to them. So when they now come in the morning and have contact with the nurse, well-dressed, beautiful looking, beaming with smiles, anxiety disappears. And then they also have the role of reinforcing what we have said in the consulting room. So when you see I said earlier that the expertise component of oncology nursing is based on skills and knowledge. And also research has shown that an oncology nurse is the best person that can take care of a cancer patient. Because most of the other nurses don't know about the radiation therapy. They are so scared of it. They thought that because the patient has gone through the therapy, the patient is radiating radiation. You are equipped with the knowledge. They thought their concept of chemotherapy, of all sorts of things are not there. So when you have an oncology nurse, based on skills and competence, you know that that person is not only going to be a nurse for the patient, but is going to support the patient psychologically, emotionally. Is going to become like a navigator. In fact, in my 30 years of practice, the best patient navigator that I can think of is a nurse. A well-skilled, equipped nurse is the best patient navigator. All those systemic barriers, physical barriers are surmounted when you are engaging a knowledgeable nurse. In my place of practice, and people that have known me, they know I will never consult, I don't work alone without my nurse. A nurse is an important, integral part of my clinic, and I'm sure people can testify to that. I've seen a lot of my oncology nurses on board, and some of them are even your members of executive. Then I will not consult without my nurse because I'm only going, they are the owner of the patient. They see the patient more, they interact with the patient more. They are the confidants of the patient. The patient has more confidence in disclosing certain things that they refuse to tell the doctor. So you want to get more information about your patient, let them be close to your nurse, and you also drag your nurse closer to you. You will realize that the outcome that we're talking about, all outcomes, all the indices will improve. Quality of life, the patient's temperament will come down, relaxation, everything will be better off because the nurse has a lot of sides when it comes to patient care. So when we talk of the outcome, when we talk of radiotherapy, they are well skilled. The role of a nurse is far beyond just coming to take vital signs. They take the vital signs. They give the health talk. It's knowledge driven. Someone that's not an oncology nurse, how do you want him to give knowledge on cancer prevention or compliance to treatment or some demystifying some concept in cancer that people have in mind? So you see, there's a lot of role. Over years, I've brought my oncology nurse to a level that patients are very much relaxed and confident in discussing with them. In fact, half of the problem is solved once I say, look, my patient, this nurse is your friend, is going to attend to anything you think you need that you cannot ask me. Please be free to talk to my patient, to my nurse. So that is how it is. The outcomes, overall survival, disease-free survival, even compliance to treatment, even improving quality of life, even at coming early, complying with instruction, taking medication. You want it to improve with respect to patient care, you get your an oncology nurse. Don't use any nurse. Unfortunately, in many of our cancer centers, they are still using untrained nurses, in quotes. They are nurses by training, but they are not trained oncology nurses. And I think we need to advocate that anywhere they are treating cancer patients, they should give preference to oncology nurses. And these oncology nurses should stay there, not be moved around from labor ward to pediatric ward to pediatric ward to accident and emergency. No, we need them to be where we are managing the cancer patient. So that is another thing we need to emphasize, because they are trained to show empathy, to show compassion. They are there to move the patient through the journey, the cancer treatment journey, allaying the various anxiety with respect to the fear of going through radiotherapy. For many people, we call it all sorts of names, Geshi. When you call Geshi in Hausa, is that you are going to be burnt. Who wants to be burnt? But the nurse will say, no, it's not, you are not going to be burnt. This is how it's going to be. Because they have acquired the knowledge, the competence to be able to counsel a patient. They are also the psychologists for the patient, because they know the patient. Of course, there will be few people that are in the profession by mistake in general nursing. I'm here to say a bad oncology nurse. I'm telling you the truth. I've been in the field for long. I'm here to say a bad oncology nurse. They are always good and they do a lot. So they help us a lot. So come to specifics of the relevance and roles in the radiotherapy facilities. Let's cite an example of brachytherapy, where we do radiation therapy using brachytherapy procedure for cervical cancer. Most of our nurses are females. Even though they have males there, they are doing very wonderful. In fact, one of the staunch backbone I have in Zara is a male oncology nurse. In fact, anywhere you have a male, when I was recruiting, I was begging for nurses. I specifically asked for young, energetic female and male to be sent to me, because the speed that is expected of an oncology nurse is a 100-meter dash speed. When you see an oncological emergency, you don't want somebody that will take 1 hour to stand up, 2 hours to move. You want somebody that in a fraction of a second, he has already seen the oncological emergency, informed the team that there is a problem. He has already prepared the way we will go. You see, that's what we are getting from a trained oncology nurse. Competence, skills, and more important, as a team player. The cancer care now is a multidisciplinary. It's not one man job. I say, oh, I'm the only oncologist, I'm the one going to, I'm the alpha and omega. No, we all have roles when it comes to caring for a cancer patient. And so an oncology nurse, just like an oncologist, just like the surgeon, just like the pharmacist, they are also part of the MDT, multidisciplinary team in cancer care. And nowhere should they be relegated. Emphasis is there. They should not be relegated. They should be part and parcel of discussion. They should contribute. They should not be observers, because they know the patient, they know what the patient is going through. They have some information that you, as a doctor, you may not have. So they are very important in navigating the patient through, before treatment, during treatment, and after treatment. Begin to talk about the whole spectrum of radiation therapy. Time will not permit me, but just know that from arrival of the cancer patient to the clinic, to the evaluation and diagnosis and staging, to the commencement of the various treatments, and now coming to specific to radiotherapy, a nurse is a very important team member. They assist the patient in going through the side effects and managing it, in counseling, in showing empathy, in being there as a friend, which we, the oncologists, we don't have that time. I'm too busy to have the whole 3 hours on one patient. There are 30 patients waiting for me. But you see, they get the contact of the nurses, they interact with the nurses even after They have left the consulting room. And if there are issues, the nurses related them to the oncologists in a way that the oncologist will understand, even if the patient cannot pass the information across. So I hope, because time is of essence here, I hope I've answered your question. If I have not answered your question, please be very specific to me again. Ask me which one that you have not answered, and I will be really willing to talk more about it. Thank you. Over to you, Taiwo.
Thank you. Thank you so much, sir. I want to confirm, can we hear me? If you have any issues hearing me, please do well to type in the chat box. Thank you so much. Thank you so much, Professor Sunday Adewuyi. That was so spot on. That was spot on. You know, I love where he mentioned that he hardly does consultations without nurses, you know, in his clinics, and how that nurses, especially oncology trained nurses, should be made to stay in oncology unit, not to be moved, you know, from one unit to the other, you know, that are not within their areas of specialization. I think that is actually a critical issue that should be addressed, you know, by the hospital and the policymakers in government and in health care settings. Thank you so much. Thank you so much, sir. And finally, we have just one more question. And yes, we've come a long way in today's discussion. We've really come a long way into this discussion. I have just, you know, gleaned so much insight, so much wisdom from decades of experience, you know, from our esteemed professionals and panelists today. It's been so amazing. It's been so amazing. Nurse Michelle Mangogolo, please, I permits me and my pronunciation, Nurse Michelle Mangogolo. I believe you're here, ma. You can hear me, please. Can you say a hello or hi?
I'm here. Good evening, Mr. Yo.
Good evening, ma. Good evening. So nice to have you here. Thank you so much for joining us and for being a part of this discussion. My question is just like a follow-up question to the statement made by Nurse Nana about the resource limitations and some of the challenges that we read about, that we know about, you know, that research has shown as being the challenges to oncology nursing care in Nigeria. And now we're addressing burnout and resource limitations. So in your role as nurse manager at NSIA Luth Cancer Center, you know, which is one of the leading cancer centers in Nigeria, how do you address challenges like burnout and resource limitations in your facility, ma?
Okay, thank you very much for that wonderful question. This is very, very nice. Okay, so before I go further, I would like to just say thank you for your hard work and putting this together. It's really, really awesome. I can see the booming in Nigeria. So Nigeria is coming, everybody's stepping up. Okay, so yeah, I'm very happy to be here. Before I answer that question, if I can just have a look at the topic that you're saying, leveraging nursing expertise to do what? To improve cancer care outcome in Nigeria. So if you just want to do a little analysis of the topic, we can see that is a very, very rich topic. So leveraging itself, if you want to analyze it, as I said, you say utilizing. So we want to utilize. What do we want to utilize? The knowledge, the skill. For us to do what? To improve what you've been doing. So it's from what we have that we can come up with something more better. It's very, very interesting, as I say. So to talk about the challenges in our center today or in Nigeria when it comes to the burnout. First of all, when we say we speak about cancer center or cancer patient, oncology patient treatment, the patients are scared of the cancer. They're scared of the treatment because it can be because of the misconception of what is cancer. And the fear of the unknown, am I dying? Is it a curse? Is it a death sentence? And when they come to us, you can see them coming and you see how they go how they exit. You see them coming, they're very strong, they're still energetic, asking you questions, and you should be able to answer those questions. You should be able to answer their concerns. Am I going to make it? Am I going to get well? You've been in this field for years, so I believe you've been in touch of this kind of the problem that such as mine. What have you seen so far? Are the people getting well? So this already is a difficult question, a very uncomfortable question. You might not have the answer to it. So it's already affecting you as a nurse. And yet, you know, you need to play that crucial role, essential role in education, information, and support. Now, when the question is being given to you, am I going to be well? And when you check that patient is a stage 4 patient, stage 3 ABC. So what do you do? And you are, because of the late coming late diagnosis and a late presentation, you try to fight that battle, and you see, you are not getting it right. Patient getting what you call PD, progressive disease, and first line of the treatment is not helping. They have not to go and do the second line. And you see this patient because when they're coming from the first time, there's this bond, it's like a family. You got to know them and they know you. You love them, they love you. It's a family. As everybody has said here, we are the ones spending more time with the patient. So we know them better. You know when they are sad, we know when they are happy. Every time when they come to us, when they are on our couch, we can see or we can tell that this one today is emotional, or is happy, or is sad, or something is bothering this person. The person has got a psychological pain, emotional pain, because all the pains, we can put them together, including financial toxicity. So as a nurse, you try to stand and close that gap. It's affecting you as well. Unless you've got a stony heart, but if you are a beautiful nurse, as Professor Sunday said, a beautiful nurse inside out. So you are feeling what your patient is going through, and you are also going through as well. When it comes to the fund, there's no money, as I always tell my people, or asking my people, the average Nigeria, what they get, can it cover the cancer care? Because people are paying out of the pocket. So you are seeing this person coming, they cannot continue with the care of the treatment. Why? Because there's financial toxicity. Because you want them to get well, you think like you can take that healing and give it to them, but you are also incapacitated, if I can call it that way. You are so limited. You cannot give it to them. And there's no fund, there's no money for them to cover for their treatment, because cancer treatment are very, very expensive. And the family is very devastated. The patient is devastated, including the nurse. This is where the burning out start coming. Because it's like you want to give something to somebody, you cannot give it to them. And apart from that, you see patient coming with what you call forgetting wound. To say it, you have to stand strong. You cannot stand the smell, because you're an oncologist. You have to stand in the gap and swallow that smell and clean that wound for quality of life for the patient. Because everybody, the society, it's like they feel rejected, but you have to stand in the gap and accept them. It's like a key and a padlock together, the nurse, this role that we play there. So we begin to also get affected when you are losing them. Losing a patient is a painful sentiment or something for a nurse, because you've been with them from day one, and you are seeing how they are dropping down day by day, and still they ask you that question. I asked you that question at the beginning. You said it's gonna be get well with me. So see me today. Am I going to make it? So you don't to look in the face of that patient and tell them that I think we are losing this battle. It's a mountain to climb. So we are being affected, and we are being burned. But yet we stand strong for them till the last time, because you know that in this case, treatment is not the option. They have to stand in for quality of life and palliative care, end of life. So you need to be there for them from the one until the end of the situation, not only the patient, also the family. Stand in the gap, play your role. Don't have a stony heart of like, I don't care. You have to have the empathy, regardless of how you feeling you, but you just stand there for that empathy. To define, the small word of defining empathy is, do you feel my pain? So we feel the pain of our patient, we feel what they're going through, and everybody is incapacitated, because you can begin to think for better option. Maybe let's say targeted drugs that can maybe help them to buy time, at least 2 years, but nobody can afford it. Those are the challenges that we face as nurses, because we cannot close that gap. We want to close it, but still something is also limiting us, and we begin to burn out. You begin to like, you want to crack because you couldn't meet your target, because the target is to make them well, make them stand strong again, make them, if we could only heal this monster of the cancer. I think for now I can stop there and wait for more questions. Thank you.
Wow. Thank you so much, Ma. It is so obvious that you're so passionate about oncology nursing care. We just see how you're speaking from a place of deep passion for our patients, and we really appreciate you, ma'am. I'm sure that everyone on this call, in this webinar right now, have been able to learn the tenets and the principles of empathy, and and guiding ourselves through patient care, even in the midst of the limitations that we have in Nigeria. Thank you so much, Ma. Thank you. Oh wow, this has been very enriching. This has been very enriching for all of us. We thank our panelists. We thank our panelists greatly for the time they made, out of their very busy schedules. I mean, we see their profiles and we know that they are very busy people.
Sorry, I take it you're not going to ask me anything, so I can zoom off. You didn't ask me any questions, but that's fine, because the panelists have really done justice to all the questions. So if you don't have anything for me you haven't asked me any questions. Yes, I think you missed me.
We're coming to you. Yeah.
Okay, no, because she was saying, she was rounding it up, and I remember she said that was the last question or something. So
I think it was a slip of tongue.
Okay. I mean, it doesn't matter if you don't have any questions for me. I mean, I can round up what everybody has said if you want me to do that. And just
Dr.
give
Kemi?
Yes.
Oh, okay. Yes, I actually I'm really sorry
It's
about
okay.
that.
It's okay.
Actually have a lot of questions for you. I actually have a lot of questions for you. Oh my God, I'm so sorry. I am so sorry.
It's okay.
Yeah. Thank you so much for calling my attention to that. Thank you for calling my attention. Yes, my question to you, I'm going to just pick the top question because I have a lot of questions for you actually. As both a cancer nurse specialist and a health policy advisor, how can policymakers, this is very important, and I can't believe I did not health policy is very important, especially in Nigeria today. And we are so thankful that we have someone like you in that space and in that field, making waves and making change in that area. So how can policymakers in Nigeria better support the nursing workforce in oncology to drive impactful policy changes and improve patient outcomes? This is very important, man. How can policymakers in Nigeria better support the nursing workforce in oncology to drive impactful policy changes and improve patient outcomes?
Okay, it's okay. Thank you so much for that question. It's really, really important. But can I just say that as an oncology nurse, just the fact that you're an oncology nurse doesn't necessarily mean you're not part of policy making. And I think that's where we all get it wrong, that nurses, I know in Nigeria, we follow a medical model. In other words, the doctors are the ones who are the leaders. But by just starting this Oncology Nursing Society of Nigeria, that's the first step. And I say that because you have to be recognized. You have to prove that you're worthy of whatever. You're not only just being passionate about what we do, but also being deliberate, because I believe that policymakers are sitting on the table and they're making policy. They're talking about things that probably none of them know anything about. So what happens to the nurse? You should be on the table. And that's why I'm privileged to be on the table, whether because it's just state. Yes, it's Lagos State. And so when anything is being spoken about certain things, at least I am there, not only representing nursing, because my position is for all healthcare providers, but for us as oncology nurses, and I'm just going to take off that hat as a special advisor, as an oncology nurse, when I was in the US, honestly, the Oncology Nursing Society had power. They had power in their numbers. They had power in the fact that what they were doing was relevant. They took part in research. I'll give you an example. NICRAT, which is the Nigerian research for cancer, Nigerian National Institute for Cancer Research and Treatment. There's not one single nurse on that board, none. And yet we do research. So nurses generally, where are we in terms of what are we doing in terms of cancer research? Being advocates, loud advocates, not just on awards. So that's why I'm saying that what you're doing right now is the first step. It's a fantastic step. You should not underestimate it. I'm going to say congratulations again for doing it, because I know that when I was a member of Oncology Nursing Society, which I'm still a member in the US, I just haven't renewed since I came back to Nigeria. They're a very powerful organization. I don't know if any of you have been to the conference that they do every year around March, April. It is amazing. The research there. I even had a paper once, I can't remember, the Congress in Florida on interleukin-2 and management. And it was taken on and it became a clinical pathway. I started that within my own small space, but went through the Oncology Nursing Society. So when we are sitting on the table is when decisions can be made and you can lead people to that. If we're part of NICRAT, then the nurses are recognized. Why are doctors recognized? Because they're doing all these things. It's not just a matter of looking after. You cannot have a cancer center, a cancer ward without cancer nurses who are skilled. We talked about expertise, which is what your topic is all about. What makes an expert? Is your experience, is your knowledge, is the skill, your compassion, every single thing that everybody has mentioned about. It is you being that person that is now going to showcase that you need me. You need me. Education, Professor has nailed it. What kind of education are we, first of all, starting off in general? And then when people are interested in cancer care, are they interested for the right reasons? Are they passionate? To be a cancer nurse is not an easy feat. You're looking after patients that are dying. You're looking after patients that you get close to. They ask for you all the time. You're the one looking after them, and then they die. So there's a lot of turnover in cancer care because some people just can't take it anymore because it's like, oh, whoa. This is too much. And that's why we lose a lot of nurses in cancer care because but those who stay, those of us who stay, it's because it's almost like a calling. It's a passion. I want to look after these patients. For me, when I looked after my patients, I got more from as much as I gave them, I got from them too. They actually helped me navigate life. And it's a give and take. and that compassion and that empathy, because cancer doesn't know anybody. It can happen to anybody, is so important. And when we do that and we come together and we do all this research and we're talking about things that can change the landscape of cancer care, that's when we'll be recognized. That's when we'll be sitting down on the table making policy. And I bet you this Oncology Nursing Society of Nigeria, after a while, as you grow in number, because there's power in numbers and there's power in knowledge. I believe that as we grow and we're doing more training, education, and we're being more vocal about the kind of care we want our patients to get. In other words, we're advocates, and we draw attention to the limited access to quality cancer care, the nursing workforce, and all that. They will come to you. The people in the leaders within the health sector will come to ONS Nigeria and ask for reps or somebody or whatever and all that. This is also important. Do you know that WHO said we have in Nigeria, we have over 110,000 new cases of cancer per year in Nigeria? Where are the nurses? Where are they being looked after? When I was at Marcel Ruth, when I came to Marcel Ruth, she just started her cancer center. None of the nurses had any cancer experience. They were just RNs. They didn't even have midwifery that came. I had to train them because I trained in America as well. So I was a lead cancer and oncology nurse at the Royal Free Hospital in London. So I did all the training where there's chemotherapy and all that. They didn't know anything. They'd never seen a portacaf. They'd never seen a triple lumen catheter. They didn't. I mean, it just wasn't there. And one of them was trained in Abuja. So when Professor was talking about education, it is so vital that the education is also of quality. There's no point in somebody going into Abuja Cancer School and then coming out and does not even have the skills, can't even tell when potassium is below this, can't tell when a patient needs platelets, can't tell when a patient needs to be barrier nursed and is neutropenic, cannot tell what oncologic emergencies are. The doctors, the patient needs us. So we're there for the patient. We're there for the doctor that diagnoses. So the doctor will diagnose and prescribe the treatment. But guess who takes over from then on? It's the nurse. It's the nurse that is holding the patient's hand. It's the nurse that is going through the symptoms, symptom management. So important. She or he has to recognize all these things. And like Prof said, Adewi said, he relies on good oncology nurses. Prof, there are bad oncology nurses, please trust me. They're just there. Then they don't have any passion for it. They want a job, and they just feel they are bad oncology nurses. And I wouldn't even call them oncology nurses because they're really not trained, because, radiation nurses at the hospital where I was talking about, Marcel, the radiation nurse is part of what makes the patient-centered care positive, making the outcome, improving patient outcomes, because right from the beginning, she knows what radiation is all about, and she tells her all she needs to look for. And when the patient starts radiation and starts having, dryness or skin burning or anything like that, who does that patient call? The nurse. So by and large, the nurse is so important when it comes to cancer care. And that is why we need to show how important we are. We need to do our work well. We need to have compassion. We need to have customer service care. We don't need to shout at patients. We need to be so empathetic, because we are the ones the patients talk to. They see the doctor, they do all the tests, they are scared. Like Nurse Michelle said, patients, who wouldn't be scared? Who wouldn't be scared? And not only that, we should also, as an oncology nursing society, we need to improve awareness. We need to take part in patient awareness and all that, so that patients can come. It's when we do these things and people see us doing it, that's when we're taking seriously that we are an integral part of patient care. Inadequate training and education we need to get rid of that. And there's a lot of things on you, ONS Nigeria, because I just know. And certification, somebody talked about certification, Professor Sons talked about certification, so important. When I got my certification over 20 years ago, I got my ONS, I did my test, my exam, and I passed. I was on the moon. I was walking on what I felt so good, because it said to me and to anybody that I am a certified. That means I got the training, I did the exam, and now you can count on me. I'm an expert. And that is why in America, they all write their names RNONC, Oncology Nurse Certified. It is something to be proud of, and I know we'll be able to do it in Nigeria. And yes, we definitely need more schools. We need more people as leaders. It's not all leaders that are oncology nurses or cancer nurses. I happen to be one, and I will always continue whatever policy it is we want change. We can change it. We need to put in cultural and socioeconomic barriers. We need to fight for people. We need to advocate for them, and then our policies will come in place. So we need to say what it is we want. That's how policies are now done. So that's me in a nutshell, just running around all the things that I had in my mind. Thank you.
So I mean, this is a perfect roundup. This is a perfect ending to our discussion today. Thank you so much. Oh, I wonder how I would have missed this. Thank you so much for. Yes, thank you, Ma. Thank you. We've gleaned a lot. I mean, we don't even want to leave this place. It left us, we don't want to leave. But it's so sad that we have to leave. We have to end the panelist discussion now. Allow me to take a few seconds to appreciate our panelists once again. Thank you so much, Nurse Nana Lawal. Please, can we give a resounding virtual applause as we celebrate our panelists? Thank you again, Nurse Nana Lawal. Thank you so much, Dr. Kemi Ogunyemi. Thank you, Professor Sunday Adewi. Thank you, Professor Deborah Esson. We love you and we appreciate you so much, Nurse Michelle Mangogolo and Dr. Zainab Shinkafi Bagudu. Thank you so very much. We are so grateful. I mean, we have reignited passions within us. This discussion and every other thing that we've done in today's webinar has, called us once again to why we are here, to why we are oncology nurses, and, called us to deeper and deeper in oncology nursing care in Nigeria. Thank you so much. We all appreciate you and we love you very much. Thank you. Thank you. Oh, it's been a great evening. It's been a great evening for us here in Nigeria, and wherever it is you're connecting from all over the world, I'm sure it has been a very good day as well. It's a good time to take a few goodwill messages. Please be reminded that you can as well make donations. We're open to all kinds of donations in all kinds of currencies. And please do well to reach out to the president, or you can reach out to me as well during or after this webinar for your donations. Thank you so much. Right now, as we're wrapping up the program, we'd love to take a few goodwill messages and as well acknowledge once again our guests. We invited you, you made it here. We're so happy, we're so pleased. Thank you so much. Dr. Olubukola Ayodele, she's a consultant medical oncologist, breast cancer researcher, global oncology advocate at University Hospitals at the NHS Trust, and as well, she just opened her cancer clinic. Can we have a brief goodwill message from Dr. Ayodele? Is she in the house? Dr. Olubukola Ayodele. Okay, all right. All right, thank you. We also have the esteemed presence of Nurse Rosaline Okumu, the President, Oncology Nursing Society of Kenya. Is she still? Yes, she's still with us. Would love to hear briefly your goodwill message for us, ma'am. Nurse Rosaline. Okay. I'm sure she's trying to speak. All right. Okay. All right. I'm sure she'll get to us. She'll get to us soon or later. Allow me to acknowledge Dr. Zainab Agudu, once again, President-elect UICC and founder of Medicaid Foundation. Mrs. Bosede Olubumi Abotu, Head of Nursing Services, Delta State University Teaching Hospital in Delta State. Professor Faith Dioga, Professor of Midwifery in University of Port Harcourt. Thank you so much for coming, Dr. Riwanu A. Yunusa. He is a consultant arthroplasty and musculoskeletal oncology surgeon in National Orthopedic Hospital, Dala in Kano. Thank you also, Mrs. Uzoka Fidelia, Deputy Director of Nursing Services, Lagos University Teaching Hospital. Also, we have Nurse Sharifat T. Shinaba. She is the first coordinator and pioneer of School of Post-Basic Oncology Nursing National Hospital in Abuja. Abigail Simon Hart, we are so glad to have you. He is the director, Brigham Cancer Foundation. Nurse Nanre Mampak, past course coordinator of School of Post-Basic Oncology Nursing National Hospital in Abuja. We also have Dr. Sam Quays, consultant clinical radiation oncologist, chief clinical coordinator, Kano Cancer Treatment Center. Then Nurse Abdullahi Saleh, representative of the ONAN, that's Oncology Nurses Association of Nigeria. You're very welcome. You're very welcome. Nurse Abdullahi Saleh, thank you so much for coming. Mr. Victor Epo, the director of Pink Africa Foundation. Mrs. Agatha Okoji, the head of nursing services, Irua Specialist Teaching Hospital, Edo State. Dr. Umar Shehu, consultant clinical radiation oncologist, Ahmadu Bello University Teaching Hospital in Zaria. I'm told that Nurse Rosaline is on and she's ready to speak with us.
Oh, yes. Good evening.
Yes. Good evening.
Thank you so much for the invitation. My name is Rosaline Okumu. I am the president of Oncology Nurses here in Kenya. And I'm so honored to be joining you when you're marking this remarkable and great achievement for the people of Nigeria and the nurses of Nigeria. Actually, the Oncology Nursing Society is going to give you a voice to advocate for what is rightful for the nurse and what is rightful for the patients. And therefore, you're going to realize that you're going to make greater steps even in this as you launch the Oncology Nursing Society, because if you consistently insist on being heard, and if you're given the chance to sit with the policymakers, and the person who goes there represents the nurse, represents the patient, and represents the healthcare at large, they will always keep looking for you. They will always ask that we haven't heard the voice of Oncology Nursing Society Nigeria. Therefore, I request that through your leadership, make the efforts to reach every sphere that you need to reach so that the nurse's voice is heard and that the patient care is improved because of the launch of the society. Congratulations from my team from Kenya. I saw you launched a very good website that will be instrumental in learning. And we are looking forward to opportunities where we are going to be able to collaborate with you. Thank you again. Congratulations to the new leaders. Please take it with a lot of appreciation and focus on what benefits the nurses, what benefits the patients, and you'll find yourself thriving as much as the nurses you lead. So I would actually like to thank my friend Mustafa for reaching out. I've seen some of the people whom I know, Madam Nana and many others. Congratulations, and I look forward together with my team to work with you. Thank you so much for the wonderful webinar. Thank you. Good evening.
Thank you, Rosaline. Thank you. You're welcome.
You're very welcome, ma'am. Thank you. It's so good to have you. And I'm sure that plans are underway, to ensure collaboration between the ONS Nigeria and Oncology Nursing Society in Kenya. All right. We also have the pleasure of having Mrs. Cynthia Nwogu. She is a nursing administrator, from Lakeshore Cancer Center. She in the house, Mrs. Cynthia. We're ready to hear from you, your goodwill message from Lakeshore Cancer Center. Okay, she's still with us. Okay. All right. Okay, while we wait for her, I also have the pleasure of inviting Professor Musa Ali Gombe, Director of Clinical Services, National Institute for Cancer Research and Treatment in Abuja. Professor Musa Ali Gombe. See with us. Are you here, sir?
Hello.
Professor Musa. Yes.
Okay.
Yeah.
Can you hear me now?
Yes, we can. Loud and clear. Thank you.
Oh my God, I am so excited to be in this webinar. Congratulations. And thanks to Dr. Chinamso, you have done marvelously well. And I am glad that to be in the midst of all these professionals, it's wonderful. And of course, for oncology, we are going to go a long way. And I just want to make sure that we all know that cancer is not a death sentence. And that's why we are all here, to make sure that everyone hears us loud and clear. And we as nurses, we have a lot of role to play, and we are not shy to do that. Like the prof said, nurses are very, very important. And we are ready to be with our patients. They do open up to us. The doctors don't spend a lot of time, which he said, and we, the nurses, we are ready and we are always willing to listen to our patients. And I love the blue and the yellow concept. We at Lakeshore Cancer Center, we are all for the patients. We have an open door policy. Our patients feel us. And when they come in, they do ask for the nurses. And of course, we work with a lot of professionals, Dr. Jimo, Dr. Iwuji, they are all oncologists, but the nurses play a vital role. And they also like their nurses with them, because once they leave the room, the patients always forget something and they will come back and say, I want to speak to that nurse that was in that room. I want to open up. I have a lot of things to say. So thank you so much for this webinar. And we are so proud that we have this in Nigeria. I mean, ONSN, thank you so much. Congratulations. And we wish you all the best. And we are all part of it. I'm all excited. Thank you so much.
Thank you so much, Mrs. Cynthia. We appreciate your goodwill message to us. Thank you for the wishes as well. We are as well excited about what is to come. Do we have Nurse Abdullahi Saleh, representative from the Oncology Nurses Association of Nigeria? Do we have this esteemed professional in the house today? Yes, I think we do. Will you be so kind to speak to us today? Okay. Representative from the ONAN. Okay. We have Veronica Bako in the house. Would you like to speak? I mean, Mr. Victor Epo, Director of Pink Africa Foundation. Do we have, okay. Do we still have Nurse Sharifa Tishinaba in the house? She was the first coordinator of School of Post-Basic Oncology Nursing. Do we still have her? Nurse Sharifa? Okay. All right. Okay, do we have Mrs. Uzoka Fidelia from LUTH, the Deputy Director of Nursing Services from LUTH? Do we still have her in the house? Okay. Okay, I think I see, yes. Okay. All right. It's been a beautiful. Yes, I can see Mrs. Uzoka Fidelia in the house. Would love to hear from you, Ma. Your good messages about this society is underway. Mrs. Uzoka. Okay. All right. All right. While she's preparing to speak, do we have Dr. Umar Shehu, consultant clinical radiation oncologist? Do we still have him, Dr. Umar Shehu?
Okay,
from
good evening,
Zaria.
everyone. Good evening,
Okay,
everyone.
good evening, sir.
All right. I want to thank you all for study and inviting me to this media edition of launching this new association. It was actually something I have been actually looking forward to, and I've been encouraging some of our colleagues here in Zaria to have an association as other professionals in oncology care have their association. So I was very glad when I saw the invitation, and I really wish you all the best. So my general advice, just like everybody has been saying, is that nurses play a critical role in the care for cancer patients, and their role can never be underestimated. But however, I must also just warn, I think the role of professionals generally is to collaborate. It's not a competition between doctors and oncology nurses, or doctors and radiographers or physicists. We're all here for the patient, and we play complementary roles based on our duties or functions also. So the nurses generally are there with the patient always, so they will definitely play a role that those that are not those that do not spend much time with the patient do will play. So we are all playing complementary role, and God willing, we hope that this association will further strengthen the impact of care for oncology patients. I think the overall aim is to make sure that the oncology patient get the best out of any oncology center they eventually go to. So I wish you all the best, and we are willing to support and collaborate with you towards making oncology care a better one in Nigeria. Thank you very much.
Thank you so much, sir. We really appreciate you. Thank you so much. Wow. Wonderful. Once again, we appreciate everybody who has made time out to be here with us tonight. It has been such a great time out, and we really appreciate. Thank you everyone for the our esteemed professionals, for the goodwill messages, to the panelists, to Dr. Jessica, everybody. We thank you so much for being a part of this, and cheers to the future of oncology nursing care in Nigeria and advancement in practice. Okay, please make use of the useful links in the chat box. We already know that there are a number of us, in fact, if not all of us, that would be interested in joining the ONS Nigeria. Please make use of the link that is in the chat box to join right away. Yes, for the donations, we will be glad to have donations. Please do reach out to the president, Dr. Chinomso, for the donations. And finally, do not forget to check out our website, onsnigeria.org, and let's get this big move started already. Thank you so much. From this point, I would love to hand over to Nurse Mustafa. It's been a great pleasure moderating this event. Once again, I am Olamide Taiwo. It's so good to be here. It's such a privilege. Please allow me to hand over to Nurse Aliyu Mustafa right now. Thank you, everyone, and have a good evening.
Thank you so much, Taiwo, for that great anchoring. You have done so much well. I'm to give a closing remark, and I'd like to start by recognizing the keynote speaker, distinguished invited guest, President and Board of Directors of the Oncology Nursing Society of Nigeria, esteemed panelists and colleagues. A very good evening to you all. It is with profound gratitude and immense pride that I deliver these closing remarks at this inaugural meeting of the Oncology Nursing Society of Nigeria. Today, we have made a history together, setting the stage for a transformative era in oncology nursing in Nigeria. I extend my heartfelt appreciation to our esteemed guest, Dr. Jessica McIntyre, President of the Oncology Nursing Society of Nigeria, and Alhaji Al-Hassan Dagi, the Registrar of the Nursing and Midwifery Council of Nigeria, and Honorable Dr. Kemi Ogeyemi, the Special Advisor on Health to the Governor of Lagos State. To our distinguished panelists and every guest who honored our invitation, notably Nurse Roslyn Okumo, all the way from Kenya, thank you so much for your invaluable contributions and time. I must also commend the dedication and commitment of the organizing committee members whose tireless efforts have brought this event to fruition. As we conclude, let us carry forward the insight and inspiration drawn from today's discussions. Together, we share a vision, and that is to elevate oncology nursing in Nigeria. Receive the compassionate, evidence-based care they deserve. The Nursing Society of Nigeria is committed to the following. Number one, capacity building for oncology nurses and other nurses working in oncology facilities by developing specialized training programs to equip them with cutting-edge knowledge and skills to deliver world-class care. Number two, to collaborate and partner with local and international organizations, including the Nursing and Midwifery Council of Nigeria, the National Institute for Cancer Research and Treatment, NICRAT, oncology nursing training institutions, and the Oncology Nursing Society of America to advance research, education, and clinical practice. Number three, to strengthen our influence in health policy to prioritize oncology care and nursing leadership in decision-making through advocacy. Number four, creating platforms for mentorship, professional networking, and support across the oncology nursing community. And lastly, promoting the use of technology and innovations such as telehealth to improve patient outcomes and access to care. Distinguished invited guests, ladies and gentlemen, together we can build a dynamic and impactful society that advances our profession and makes a meaningful contribution to the fight against cancer in Nigeria and beyond. Finally, I call on stakeholders and potential collaborators to join hands with us. Your sponsorships and partnership are vital to our collective success and the advancement of this noble cause. Thank you for being a part of this journey. With your continued support and active participation, the Oncology Nursing Society of Nigeria will flourish and make a lasting impact for generations to come. May we all live here inspired, committed, and ready to make a difference. God bless the Oncology Nursing Society of Nigeria, and God bless us all. Thank you so much. Thank you for attending this very, very important. Back to Taiwo, please.
Yeah, I think we are done. So thank you very much, everybody, for participating in today's historic event. And we hope to reach out to you soon for collaboration, for support, for donations, for advice, and also to partner with us to move the mission forward. Thank you so much, and we appreciate everybody. Thank you, and thank you.
Thank you so much. Thank you.